Hey, good morning, everybody. I see we've got some folks coming in already into the meeting. We're going to get started in just about 2 minutes here. So thanks for joining us this morning, and we'll get started in just a minute. We can give just about 1 more minute for people to join in. I see we've got 8 folks already attendees. So thanks for joining us, and yeah, we'll get started right at 9:01 here. All right, good morning, everybody. Thanks again for joining us. Before we get started, I've got a few housekeeping items that we're gonna roll through. This session is being recorded, so we'll make sure to have the video available afterwards. Put that on our website, some follow-up communications for everyone. As we go through the session, feel free to use the Q&A function. We do have time set aside for Q&A, and we'll make the raise hand feature available as well, so that you can ask questions verbally in addition to typing them in the Q&A box. And we are going to have some follow-up communications available, and this will be on our website. There's some more resources there under results framework in the grant making session, so be on the lookout for that. And with that, I'll turn it over to Howard to get us going.
Hey, thanks, John, and good morning and welcome, everyone. My name is Howard Brown, Senior Program Officer here at the Foundation. I have the honor to work alongside a very talented and passionate team. Some of them are here on the call with us today. Program Officers Aisha Cooper and Dr. Craig Kalistra, and grant writer Chris Worsbowski, and the newest member of our team, grants manager Jill Kaufman, is here. Please give a warm Zoom welcome to Jill. The fact that you are here today is a product of some of Jill's great communications work, and we just are really honored. I'm excited to have Jill here with us at the Foundation, and you'll actually hear from Jill a little later in today's presentation. So as you know, over the past 2 years, the Foundation has been working to refine the way we look at impact measurement. And last fall was our first official grant round, launching the results framework. And we also presented to most of you last winter the framework to prepare for your letter of intent, and of course today's presentation to talk about the application. And over those past few years, we've also done a lot of Zooming and have less frequently had the opportunity to connect with you in person, and we really do miss seeing you all in person. And you know, while we long to return to safely connect with you soon, we shouldn't forget some of the ways that we learned to leverage technology to bring us closer together. One of those ways is to, just share who you are, where you're from, and some information in the chat. So if you would be so kind, please share your name, your organization, and something fun, your favorite game show in the chat. If we could all do that, that would be great. Share it with all. So I haven't put mine in chat yet, but my favorite game show was always Press Your Luck. I really loved Press Your Luck. And I know I would have avoided all whammies if I would have played. But thank you so much for participating in that. I see some Wheel of Fortune. That's great. Jeopardy, yes. Big fan of game shows, so thank you so much for sharing. But now that we are experiencing the lifting of some of those, restrictions, and we can have opportunities to move back to in-person meetings, we definitely acknowledge that human connection is inherently healthy. Let's do it safely, but also let's continue to look for opportunities to provide safe spaces for us to, pause, connect, and be safe socially and emotionally. And many of you have really demonstrated some of your expertise in those areas, and I appreciate the opportunity to learn alongside you. But today we'll take a closer look at the results framework, how it applies to your applications, and we'll continue to learn together. And we recognize that you could have been anywhere else in the world, and you chose to spend your morning here with us. And for that, we thank you, and we're very appreciative of your work and your commitment to serve our community. So with that, it's my sincere pleasure to introduce to you, probably for the second time if you joined us back in the winter, but the founder and president of Community Impact Consultants, philanthropic impact subject matter expert with more than 20 years of experience designing, implementing philanthropic and social impact initiatives, our friend, Michelle DeSabato.
Good morning, everyone. Yeah, I started in kindergarten doing this work, everyone. So I'm just gonna, I'm gonna come off camera so you guys can focus on the content and not me. And we can jump in. So hopefully you can see my screen before you go off camera, if someone can give me a thumbs up. Thanks, John. Okay, so let's jump in. We're going to cover a bunch of different things today. First and foremost, that high-level overview of what it means. We're talking about investing and not granting. Howard, mentioned that some of you may have seen some of this, heard some of this. So we'll just kind of set the stage. From there, we're going to go deep into the foundation's framework so that you can see all the different ways they're looking to get to impact. And most importantly, we're going to step you through the application and share with you the types of answers that we're looking for so that you're really prepared to go forth and complete the results-focused application. As John mentioned, we'll have some time for Q&A. Definitely use the chat up top. Make sure it's set to everyone so that we can see it. Any questions that are coming in, we'll be monitoring it. We have some natural pauses. And as I said, we have time at the end to go through some Q&A. So let's jump in first to this concept of results-focused investing and what's different about it from, the way the foundation and other funders used to approach giving. So traditional giving really focused on, hey, we're going to fund nonprofits and programs that align just with our mission, because our mission is that, that lofty state that we want to get to. On the results-focused investing side, we want to not only find nonprofits and programs that align with our mission, but more importantly, that they're contributing to a desired impact. And that's what you'll start to see us talking about. Where's that connection point between the foundation's mission and vision? And that's the programs that we want to fund and the impact that we seek to have. To do that, in traditional giving, we used to ask these open-ended questions about activities, what you're up to, maybe get some outcomes, number of meals served if we're in a food bank, which is really an output because that's not a change in behavior. And what that did is just gave us a lot of narrative. We couldn't actually look at data to see if we're actually moving a needle. So what the results focused investor does is really define not only that desired end state, but behavioral changes or indicators that they seek to monitor to get to that impact. And we're going to talk a lot about that. So we'll get clear about what they are for the foundation and why we believe we could do it without telling you how to run your program, because you guys are the experts in your program. When it came to decision making, we reviewed application, I used to call it the compliance perspective. Is it complete? Is it clear? Are all the narrative questions answered? Can we see where it's going? And of course, we wanted to make sure that we understood it and that it made sense for who we were, but we didn't really focus on the so what, the impact. And now it's this concept of looking at narrative-based questions, specifically as I refer to them, the who, what, how, and when. Who are you going to impact? What impact you'll have on them? How are you going to get there? Your key project elements. And when will you know you succeeded? Some kind of verification so that we know you're tracking. And we look at those narrative questions aligned with some data to start thinking about risk and return. Is this a good investment for the foundation? What are the chances you're going to get to the stated results? What are the chances you're going to have some learning? And is the return good because of all the other opportunities that we have? So, changing that mindset to be an investor versus a grantor. Granting is to bestow, investing is we want to invest in social change and social impact. And finally, we all know this foundation didn't do this, but most traditional funders used to just say, hey, give us a final grant report, tell us what you did. We want to partner. We want to make sure that this journey is not only about impact, and really it's about learning what works and what doesn't in each of your spaces, in each of these program areas. So we partner with you throughout the grant program and throughout your grant to see what's happening, to make sure that you're able to stay on track. And if not, maybe there's some other way to support you. So what this all looks like is, if we start thinking about a really fictitious example, is we're moving from activities to results. So in a fictitious example here, a traditional giver would say, hey, I gave $15,000 to a food bank, and they're going to do all these activities. They're going to conduct these nutrition education classes, for up to 500 families, and it's going to take about 10 weeks. And, we're just hoping that they learn something about proper nutrition. The results focused investor talks about their investment very differently. We've invested $15,000, same amount of money, to empower 430 out of 500 families that participate in our program to sustain a healthy diet and adopt a healthy lifestyle for a period of 3 months or more. So we know how many people we've impacted. We know what they learned. We know what's different about them. We put a time frame on there because we know that a food bank isn't going to be able to stay with them long term to see how well it's stuck, but we can see some behavior change that is lasting past the program. So that's the mindset shift. Instead of thinking about all the different things that you're doing, thinking about what's different for those that participated because of all the stuff that you're doing. What we hope it helps you do is, because the foundation's getting clearer, or the funder is getting clear about what they want to fund and their desired impact, we hope it makes it easier for you to understand what they're up to. And if your program aligns, it enables us to streamline and focus the reporting process. We don't want to take the dialogue out of it. And I know the foundation has shifted to that dialogue way, but hey, how are you doing? Are you on track, off track? If you're off track, what are you doing to get back on track? Can we help you? If you're on track, woohoo, we celebrate it. We also think it helps you because you're starting to think about your programs a little differently. Thinking about them in terms of success, thinking about them in terms of verification and success being achieved, and monitoring the budget, to make sure that you're on track. Ultimately, what we're aiming for is to create a higher dialogue around the needs in the community, the types of hard projects that can get to deeper impact within the Pottstown community to ultimately deepen partnership. So we're excited to dive in and start thinking about the actual framework for the foundation. So for many of you, the purpose and mission, you probably have seen it before. If you look closely, there's slight tweaks to it. And really where that is it comes down to equitable opportunity, this concept of making sure that all residents, inclusive opportunities, have the same access. And that's really where we wanted to make sure that we called out what's different about the foundation's purpose and mission. However, to get there, we got clearer. We have these pillars that will help us get to this visionary state of area residents living vibrant, healthy, thriving lives. And there are two pillars that are funding strategies, and one of them is the one we're going to talk about today, this concept of promoting equitable health and wellness. And then we have developing youth potential. The third pillar, collaborating for a healthier future, is in support of that. And that's the other types of engagement that the foundation seeks to get involved in. Anything that they do there will contribute to promoting equitable health and wellness, developing youth potential, all to get attached to that mission and vision. So if we start to build out, as many of us know, a logic model, which is really what a results framework is, we can start to think about if our purpose is to ensure equitable access for all community members to embrace a healthy lifestyle. Ultimately, if we're achieving that purpose and our mission in how we're going to get there by providing education, funding, and programs to provide that equitable access, we'd get to our visionary state. We talked a moment ago about our 4 pillars that would get us there. However, we can't stop there. We need to think about what it would be in each of these pillars that would make us get to this visionary state and really connect that mission and vision. And that's, again, how we're going to engage, but more importantly, our desired impact. So staying really focused on our promoting equitable health and wellness pillar, which is what we're here to talk about today. If we're successful, we have a visionary state or a desired impact for that pillar, that community members benefit from equitable access to spaces, services, programs, and resources, enabling them to embrace a healthy lifestyle. You can see that on collaborating for a healthier future, again, it's the engagement strategy versus a direct funding strategy. And that's where the staff will engage and empower a diverse set of constituents and partners to bring together to support the healthier future for all residents. And in developing youth potential, community youth are healthy, thriving, and learning now and in the future. So if we stay with our promoting equitable health and wellness, again, we're still kind of at a pretty lofty statement, right? Community members are benefiting from equitable spaces, services, programs, and resources, enabling them to embrace this healthy lifestyle. Okay, what do you mean? How are we going to get there? The next level that we go down is thinking about the types of programs that will get us there. And we've specifically outlined 3. The built environment, which our goal there is to promote community wellness through the development and improvement of and access to active living spaces and programs for all. So again, for all, equitable, making sure that that concept runs through each of our program areas. In health and access, you can see that concept of for all and equitable just in the desired end state. We want to improve access to affordable, high quality, culturally and linguistically appropriate care for all community members. And then health equity is about removing barriers to health and wellness to ensure all community members have a fair opportunity to attain their full potential. So maybe mitigating some social determinant of health. So as we layer that in, we need to then start to think about who we're trying to change to get to there, or who we're working with to get to there. So in the built environment, when we layer in our stakeholders, we're going to ultimately hope to improve access to these spaces for all community members, but we're probably also working with municipalities and community facilities because that's who's maintaining or we're funding to get to promote the spaces, to build the spaces. Or a stakeholder, or who, if you think about my questions earlier, they're who, how, what, and when. The who is our stakeholders. And again, in health access and delivery, it's our community members. We will talk a little bit about some of the underlying diversity that we're looking to get to for each of these areas, just to make sure that our partners are focused on diversity, but ultimately that's who we're trying to change. Same thing in health equity, not a surprise, but again, getting clearer about the who we're working with and who we're seeking to change is an important part of making sure we're clear about what we're trying to achieve. Once we know all this, there's also different ways that we can invest to get to there. And that's that arrow that's going across where we're talking about systemic reform, grantee capacity, program support, or direct service, as some folks call it. So let's talk about these types of investments that the foundation is willing to invest in. From a systemic reform perspective, this is that macro level change. We're trying to change policies. We're trying to develop best practices. We're trying to bring in interested parties to really further the field. This is usually a longer term change. A grantee capacity is specifically about your organization. We're hoping to invest in something to ultimately improve or increase your capacity to achieve results. And program support or direct service is investments in your programs that are existing that will ultimately serve the community and its members. So those stakeholders we just spoke about. Once we know the type of investment, we also have to think about how that connects to results, because there are different results you seek if you're doing systemic reform versus program support. That all will contribute to the foundation's desired impact for the program area, and ultimately their mission and vision statement. So if I look at that and I start at the macro level, again, trying to inform change to change policy, maybe it's state policy, maybe it's local policy, to develop a best practice in delivering of services. Again, we know this is long-term change. It usually, if you think about changing a policy, it's not going to happen in a one-year grant term. So the results, when we start to think about them, become, okay, ultimately, what are you seeking to do? That's that long-term. What will be different and for who and by when? So defining, okay, we're trying to affect policy in health equity by changing a law to benefit a certain population, and that's going to take us 5 years, or it's going to take us 7 years. But during this grant period or the short term, this is what we'll accomplish. Maybe we'll get some leadership involved, and we'll go through a couple of examples to make these a little clearer. In capacity building, again, this is grantee capacity building. This is about your organization being able to put some kind of build and develop some kind of capacity for your organization that's ultimately designed to increase or improve your organization and your organization's ability to get to results. And as I said earlier, supporting existing programs, what we're going to look for there is a change in status, condition, or behavior for the individuals served. And the foundation has outlined their specific behavioral changes and their specific results for capacity building. What does that look like? So let's talk through what all of those are before we get into the application. The number one thing I get when I say, hey, we've gone through and we've, as a foundation, identified the behavioral changes or the results that we want you to monitor is, how do you do that? All of our programs are different, even in like program areas. And the way we believe we can do that is focusing it on behavioral or conditional changes, KBIs, as I like to call them. And while we present this linear, we know human behavior isn't linear, but it's a way to think about it. And it's this concept of a continuum of change. In order for any change to happen, you need to have an initial connection, maybe of creating awareness for your participants, creating an awareness in the community of a gap in services if we're going to try to do some practice development, a gap in your organization to maybe deliver your services or get deeper results. Once you have that connection or awareness, activities are happening. This is where all the program stuff is happening. And you have some active participation on the part of your service participants if you're in direct service, maybe the community if you're trying to do a collaborative and systemic reform, ultimately getting to some initial improvement as the program continues to function and hopefully participants or the field or your organization goes along this continuum. And as I said earlier, we know that's not always the case. Some people lag back, but ultimately we start to get to this concept of lasting change or transformation to contribute to the desired end state that you're trying to get to. So again, focused on behavioral change. So what that looks like from a program support is, hey, a participant has an initial awareness or connection made with the program or what your organization or what they're offering. In improvement, they're actively involved, they're showing up, they're going to their appointments, they're using a prescribed regimen by a health professional, and we start to see an initial improvement. Ultimately, we're monitoring them and hopefully we get to a lasting change, a SDOH or social determinant of health is mitigated so that we can get to that desired end state. So let's take a look at each of the program areas that the foundation is funding and what that looks like from a program support of each of those areas. So in the built environment, it's a little bit different because we're not dealing initially directly with trying to change a person. We're trying to change the environment. We're trying to change facilities. We're trying to improve active living spaces. So in that connection piece, it's that awareness of, hey, there's a gap in the community. There's an opportunity to improve access. So if you think about, one of the stakeholders we talked about earlier was a municipality or a facility, you can see how that body, that being, that entity is starting to identify those gaps. And then they have to develop a plan or create an action plan to improve those spaces. They then have to get the necessary buy-in and potentially some resources. When we go into improvement, you can start to see they're starting to complete the improvement efforts. They're starting to make sure that there's access through public transportation. Ultimately getting into change that we see our other key stakeholder in the built environment actively using it. So the change is happening for them. They're productively using it for the first time. They're using it on a regular basis. So again, this one's a little different because we're starting with one set of stakeholders, but we ultimately want to make sure that our community members, all community members, have access to these spaces. If we go into health access, again, existing programs, direct service, program support, we start with that connection piece. Hey, they enroll at a facility. Maybe they're getting some screening to become aware of a potential health issue. From there, they're starting to actively participate, as I said earlier, maybe using the resources to prevent or treat a health issues, following a prescribed regimen by a health professional, confirming some initial improvement, and ultimately, if going into change, achieving a recommended health target and maintaining it. So this one, we're staying a little bit longer with them. You can see we've defined long-term stabilization because we know you're not going to stay with some of these folks for 3-5 years. So what does that mean from a health perspective? And health access, again, this is removing or mitigating a barrier to health and wellness. So again, becoming aware of services or supports, engaging in them. Going into improve, that's where active participation starts to happen. So we're starting to see that their immediate financial, social, or physical needs are addressed. Hopefully getting their immediate situation secured. And then moving into change. Maybe they have to go deeper and enroll in a different program, build new skills or capacities to ultimately close or mitigate a social or economic determinant of health. So again, all on a person basis. Hopefully you can see through there how some of your programs may attach to these. We're not telling you that you have to have a number for each of them, and we'll get through that in the application, but it's thinking about the activities of your programs and how they are changing or affecting people's behaviors. In the other types of ways that we fund, the systemic reform, for example, here's practice development. We have to, in that connection piece, identify an issue or define it. We have to then start developing that best practice. So that could even be, a 3 to 5 year situation there, just getting it developed. But once it's developed, it has to get disseminated. It has to be agreed upon by practitioners in the spaces. So if you think about health access, we need them to, the service providers to agree to adopt a new best practice. But we also need to build their skills and implement it. So you can see this is longer term. That front piece may take a while just to get it developed. In the collaborative, again, this collaborative may attach eventually to a policy. It may attach to a best practice, but same concept, creating an awareness of a need, identifying an opportunity to align, making sure that we're starting to actively participate by making sure that we have the voice and view of those affected to help defining the solution, agree on the approach to getting there. And you can see taking it there to implement a new capacity, a new best practice, maybe a policy to and bringing it to scale within the community, which then attaches it to this concept of advocacy and community influence. And you can see similar concept, need to get defined. We need an action plan here. Ultimately, we need to bring the policy, get the policy enacted and to scale within a community. So again, bigger, loftier ways to approach it. I'm going to pause. Oops, I went the wrong way. Or actually, I missed grantee capacity. Apologies. So grantee capacity is again about your organization, gaps within your organization to get to results. So usually what we look for on the impact is this concept of increased efficiency or increased effectiveness. But to get there, same concept. You need to identify or create that awareness within your organization of a need for your organization. Then you start to go into the active participation by identifying and updating systems, policies, materials, practices, and implementing them and bringing them to scale. Ultimately, we want to see these desired end states of increased efficiency. So potentially something that will help you reduce your cost or increase your organizational revenue, and ultimately improve results or increase effectiveness for those you serve. So now I'm going to pause before I go directly into how we take all of that and step you through the application, but just want to see if there's anything out there question-wise, give you a chance to type questions and take a sip of water at the same time. Okay, just remember the chat is there and this is for you. So we want to make sure that you get all your questions answered. So what does this framework change about the application process and ultimately the decision-making process for these new results-focused investors at the Pottstown Foundation? It started already. You probably should have saw some of this already during the LOI process, but we've already started to say, okay, which program area is your work going to contribute to? And we've asked you that, and we've asked you to identify that. We've also started to ask you during that letter of inquiry, the LOI process, to think about the type of investment. And hopefully you've had dialogue with your program officer and you start to see where the work that you're doing is aligning. But now that we've gotten there and we've asked some narrative-based questions, give us a program description, we're going to get really detailed in the application. And if you think about that first slide that I shared when I talked about the who, what, how, and when, that's where we're going to go. We don't want to change how you think about your program, but there are critical questions we need to know about. And those critical questions or the narrative need to get attached to some form of data so we can monitor how you're doing, We can, at the foundation, roll up investments to talk about what they've invested in to see how we're contributing to their goals and their logic model and their results framework. So if we think about the who, what, how, and when of grant making, let's start first and foremost with the who. Who or what will your work impact? Again, it changes based on the type of investment you're seeking. For systems change, we're looking to change the field. So we're going to ask you to focus on the type of change that you're looking to affect: policy, advocacy, best practices, and what it will mean for the field. And the field there is, health equity. The field there is health access and delivery, the built environment. So what are you trying to do, and for who is the field? In grantee capacity, you're trying to change your organization. But we also are going to ask you the type of capacity you're looking to build. And I'll share with you in a second, there are specific types of capacities that the foundation is willing to support. And when you think about that, what will it help your organization achieve if we put this capacity in? And obviously, direct service program support, we want to think about who your participants are. So who they are in health access, what defines them, and what are the barriers that they're facing to getting to achievement. So when we look specifically at the application, here's the system change application, and it's a direct image, cut, snap image of the application, but you can see we're focused on the who. What is the population or place that you propose to help? What type of change are you seeking to build? Direct questions, getting to a little bit of the narrative, explaining it. On grantee capacity, as I mentioned a moment ago, there are specific types of capacity that the foundation is willing to support or invest in. And you can see they range from staff and board development to developing a new program to address a specific community need, to focusing on DEI, diversity, equity, and inclusion, and we've defined them all. So tell us in the who for grantee capacity, the type of capacity, describe this new capacity, and most importantly, why now? What will it help your organization achieve, and why is this now a good time to do it? The who for direct service is probably the one that we're all pretty much used to talking about, but we change it a little bit because, again, we want to know the who and what challenge or opportunity are you trying to solve, but we also want to know the level of difficulty or the barriers that they're facing to get them there. From there, we also think about those barriers in terms of level of the participants that you're serving. Are they, all in that high range? I'm pausing for a second because a question came in. So the question is about, why does it have to be a new grantee capacity? So I'm just going to go back for a second. So this is the investment. So you're seeking to change something or improve something, and that's the new grantee capacity. If you already have a capacity in the area, yeah, it is a good thing, but then you're investing in direct service because we're going to support you in continuing to support your program. The grantee capacity is to help you do something differently and help you build something differently. So I'm hoping that answered your question. So that is the who, but let's take an example and for each of these and look at it as it attaches to a program area. So let's start with systems change. We're going to stay in built environment for systems change, and who are we going to work with and who are we going to impact? So the type of change that we're looking to invest in systems change is community and community influence and advocacy. And the specific population that we're trying to do is we're trying to gain support and community and leadership support to create an infrastructure for urban communities within Pottstown to access active spaces by public transportation, more importantly, reliable public transportation. So in order to build that public transportation, we need to gain community and leadership support. Again, longer term change. In grantee capacity, perhaps you need to do some staff and board development. And, when I mentioned earlier that the why now is important, you can see, I would say, if you just said, hey, we're going to do some staff and board development, the why now, you can see staff turnover and burnout is at an all-time high of 20% annually. So the specific capacity that we're looking to build is to develop and provide training and professional development to all levels of staff within the organization, ultimately to reduce that 20% turnover rate and burnout rate. In direct service, we're focused on health access. And again, sorry, grantee capacity, we were in the health equity area. Again, you can't see the direct attachment to the area, but we're hoping that the program area that you're in does get attached to the foundation, or not even hoping, it needs to. So in health access and delivery, our population are low to moderate income persons without access to appropriate care and resources. So when we start to think about what that means, how do you define that population? We start to think about the barriers that you're facing. And you can see that 65% or higher live under the region's median income level, 40% does not have English as their first language, and 15% are not legal immigrants. Again, all of these are fictitious, just trying to get you concepts of what we mean by the who and what your impact will be. So just chunking it down into bits of information. We'll share later how that gets built as you build your narrative, but these are the things that we need to see in those narratives. So we talked about the who. Now we need to go into the what. What impact will you have? If you think back to my earlier slide, we talked about the types of results, and that's really what the impact is that would have. So for systems change, again, we need a long-term and a short-term. Long-term, what will ultimately be better for the field and those you serve, and by when. And short-term, what will be accomplished during the grant period. Again, for grantee capacity, what will your organization be able to do more effectively or efficiently as a result of building this new capacity within your specific organization? And direct service, what will be different for the participants? And there you can see the direct alignment, usually with the continuums that we shared earlier. But let's take a look again at what that means. So for systems change, we have very specific questions to get to that what impact. And you can see they directly link into what we've been talking about, long and short term. The long term being, what results do you anticipate achieving once this change is fully made? And the short term being, please describe the specific results you anticipate during this grant period. We asked for some projected numbers of who can benefit and by when, and then attaching that all to the continuum specifically for the short term. You can see here, and I apologize, it's probably a little small. I will also pause and say that this deck will be circulated to all of you. So I should have said that earlier, I apologize. So if you're scrambling to take notes or take a screenshot, you'll get the slides. But here, that short-term change, okay, within the specific type of systemic reform that you're trying to implement, how far will you get? These are those continuums. We're going to identify issues. We're going to develop or the best practice. We're going to get it piloted. Maybe that's all that you do. Maybe if you're in advocacy, you've been working at this for a while, and you're trying to get that local leadership engaged over the next year. Again, check boxes to tell you where to attach to. So again, the what is, what will you ultimately seek to achieve once it's implemented? That narrative question attached to ultimate numbers that can benefit and by when. The short term is, tell us what you're going to do during and achieve during this grant period, and show us along the continuum where you think you are. The what for the grantee capacity, you can see we have very specific what's here. If you think about what I said earlier, ultimately it's improving effectiveness or efficiency, and effectiveness could mean reducing costs because you've implemented this new capacity within your organization. You've increased revenue. Effectiveness, you're increasing those served. you're getting better results for those served. You're going deeper along one of those programmatic continuums, or maybe it's just taking you shorter time to get your participants to a result, meaning that you can get more people through the project. And you can see how we attach values to that. So we'll ask you to tell us the what by telling us what impact you're going to have for your organization and quantifying it. If you're going to have a capacity saving, if you're going to have an increased revenue, or ultimately if you're getting more people to benefit because you're increasing number served or results for those served. So now let's think about the programmatic. And yes, this one looks a little different because I want to remind you of the continuums, now looking at them vertically, but they're still the same continuums. In the built environment, again, it's a little bit like the system change, where we'll ask you where you attach to that continuum. But in the other two, we're actually trying to change people and the behaviors of those people. So we're going to ask you about those served and how many get attached to one of these behavioral changes. So what does that look like? Here you can see in the built environment, tell us, how far along you'll get developing this, program in putting it into the community. And ultimately, if we can get some numbers about, who the community members productively using it on a regular basis. If we move into health access and delivery, you can see it's directly the continuum. How many people will you serve? And of those served, how many will get screened? How many will access appropriate resources? We do not expect a number for each of these. We do need a number served and at least 2 other measures to be achievable, but we want to know what you're already tracking, and I'll get into that in a second. Barriers to wealth or health equity. Again, same thing, number served, become aware. You can see how we attach it. If you think back to the continuum, these are the numbers. So if we start to think about an example, maybe we only do the ones that are bolded. That's what we can track. That's what we have the ability to. We know that not every program is going to follow every step of this continuum. We don't expect that. We also know for those that you are tracking, not every participant is going to achieve the same level of success. We're dealing with human behavior, so that will never happen. So let's take a look at building out that complete program example. You can see we already know our investment type. We know the who. Let's layer on the what. So in built environment, again, we were trying to get public support to start building reliable public transportation for urban areas. So long-term, our goal is, we want to make sure that public transportation is available from town center to at least 4 rural parks and recreation centers. But, in this current grant period, which is usually maybe a year, we need to get agreement by these key stakeholders to work together to address the issue and maybe get some local leadership support of our plan. In grantee capacity, we knew we were trying to address staff turnover and burnout rates that are really high by doing some board and staff development. Ultimately, the belief is that, once we put this in, we start training folks, we can reduce that turnover and ultimately reduce costs, because we have, we're going to decrease hiring costs and training costs annually by $38,000 for the organization. And in health access, again, looking at, making sure low to moderate income persons have access to health care and resources, specifically those that have these barriers within our service area. You can see, the grant will help us serve 1,500 low to moderate income persons, and these are the behavioral changes. We're going to get 95% of them screened, 80% that will become aware, 80% of the 1,500 will become aware of an issue, ultimately getting 40% to confirm an initial improvement. You should be able to see those are directly from the continuum, and we're not tracking all of them. So that is the what. So we've talked about the who, we've talked about the what. the last part of the what is really looking at all that and creating a result statement, a direct impact statement. So on the previous slide, we had these lofty statements, lofty goals. Now, how do we make a concise statement to talk about it? So the result statement can be single focus. Hey, we're going to get 600 out of 1,500 of these low to moderate income members seeing an improvement. Really focus. But because we're dealing with human behavior or conditional change in an environment, it could also be a menu. So we're not trying to get you to, say we have to get to the lowest point, the deepest impact. We want to see what you're doing and how you think about your program in terms of results. So a menu option, we're going to serve 1,500, and of them, 975 will show an improvement in at least 2 of the following ways. And again, direct behaviors off the continuum. So we attach it in a narrative. We have a specific question right on the application that asks us, what's your results? Tell us what you're going to achieve. And you can see, we try to get them into a concise statement. By the end of 2027, this new public transportation system will enable 15,000 urban residents to achieve to access rural green active spaces. However, during the current grant period, we're going to, through our active engagement and advocacy, we're going to get at least 5 local leaders to endorse our action plan so that we can start securing resources to build this new public transportation. And our grantee capacity, we're going to try to reduce our staff turnover overall, to bring it from 20% down to 10%, saving our organization 38,000 by the end. What you'll see in each of these statements is we have an achievement. We talk about the achievement. We talk about the for who the achievement is for, and the by when, taking it through. So in the health access, by June 2022, 600 of the 500 families will have access and use the treatment appropriately. We'll start to confirm an improvement in their health. So again, the who and the what help us get to an achievement statement, a result statement. But if we leave it at that, we're not 100% sure if it's a good investment. We know what you're saying you're going to do, and we're hoping that you're going to get there. What we need to know now is how you're going to get there. And the how becomes attached to this concept of what are the key elements within your program critical to achieve the success. And I will say that this is the one that trips a lot of folks up, so I want to spend some time on it. These critical elements are pockets of the work that need to get done that we can see attachment to those results. So if we think about that health access and delivery program, if we're trying to get our population that had specific barriers, lower income, access to primary English not being a primary language, etc., how do we get a program out to them, and what are the ways that you're delivering it? So maybe you're going out and doing an awareness campaign. Maybe there's a mobile clinic that's going into their community. Maybe we're having the case managers that get assigned to them. So there's the components of the program that then will get attached to results. So what that looks like, if we look at each of our areas, we start to talk about what's needed in our program and how they get attached. So in our systems change, you can see we have, maybe we need to do some discovery and requirements gathering. Maybe we need to do some stakeholder engagement by conducting interviews or focus groups. Maybe we're doing benchmarking. You can see what those are to ultimately get us to that state. Same thing for our grant capacity. In order to do the development, maybe you're hiring an external resource to support the project. Maybe you're doing an assessment of what's happening in the organization to get to what has to be developed. And maybe that's in conjunction with the external consultant you brought in. But ultimately, you need to launch and start delivering the trainings. So if we look at each of those are the things that you have to do to get to your achievement. the building of the how becomes attached to timing as well. So if we have our key elements, what will be achieved, what's the point of doing that key element, and what's the timing on it. And it may be ongoing timing depending on what the element is. If you think about a mobile clinic, that may be ongoing throughout the year, but we just attach timeframes to it. So if we're going to conduct an outreach program, ultimately hoping to get 1,500 new patients to sign up, maybe we're doing it, my year is off there, I apologize for that, but you attach it to that. And again, all of this creates a story, and you can see in the application, we'll give you the guidelines to do that. Tell us what the element was, tell us how you know you all achieve that element, or what will be that indicator of success, and by when. You need to provide the foundation with at least 3 critical project elements and milestones. I think we have room for up to 5. What also gets built onto the how is some of the traditional questions that you would think about. You know, we know what the components are, we know what the steps are, but who will help you get there as well? You know, who will lead this program? Do you have an internal program staff, an internal program manager? Do you have partners? So they will get you, the who of this will get you to the how. Finally, because no funder funds in perpetuity, unfortunately, we know, but you know, we also need to think about sustainability and sustaining your organization. So make project and sustaining the work. So we attach that to the how. So if you think about it, excuse me, we went through the who, the what, and the how. The when is what we think about in the results-focused investing space as verification. I want to state right out there, we're not asking you to go out and put your own framework in together. Verification is just what you're using to track your progress. It's usually existing tools that you have. Maybe it's your case management data or notes if you're in that health access space. Maybe it's observations by staff. Maybe it's self-reported behaviors. Maybe it's some of that stakeholder work that you're doing in the built environment. We're not looking for you to go out and do anything beyond what you're doing, but we want to understand how you're tracking these behavioral changes. So if we think about our 3 areas and our 3 projects, again, you know, if our goal is to this year get local leadership support, maybe it's just some of the local leaders actually putting out a public statement or signing an agreement to help us bring in the contractors to start building the infrastructure. In our grantee capacity or health access, human resources is probably tracking hiring and training expenses. That's how we know if we're on track. Again, it's something you're already doing. And in health access, you know, maybe we're doing a new patient intake, maybe we're doing patient visit notes, and maybe we are surveying patients. Again, it's what you're already doing and how we can just say, we know you're tracking towards success. We will ask that direct question as a narrative-based question. Let us know how let us know how you know your project results have been achieved, apologies, and what information that you're using. All of that gets attached to the story. And that story starts to, as we hope you started to see, starts to combine narrative, what you're used to, with some data, so that we can start to see achievement. So let's take a look. Here's the example on health access. We've chunked it down very, you know, into these small bits of information. If you start to build out and start to write your grant like you normally do and attach these critical bits of information, we start to tell the complete story. Again, the who, we talk about the community, why it's now, what they're facing. All those bits of information become more relevant when we start to talk in narrative statements. We need to see each of them. We need to attach it to the who of what that community is that you're trying to address. You can see what the what becomes. It usually becomes that result statement that we talked about. The how, you know I bulleted each of these critical elements, but talk about why they're important. We need to see them. We need to see what those elements are and understand why they get attached to the program and the impact that you're seeking. And then we talk about the verification. So wanting to make sure that you understood that we're not really trying to change a grant writer's perspective. We're just trying to get to defined answers within there that we can attach to results. Before sorry, I forgot about this part. You can see here, this gets connected to the continuum. You can see now more clearly those numbers along the continuum. We're not trying to get to all of them. We've skipped one in the middle because we don't track that. We have no way of, surveying folks. Again, it's what your program does. And we also attach the how gets attached to the critical steps and milestones, the project elements and deliverables that we want to get attached to. In each of the program areas, it looks a little different. As I said earlier, with the data points, the narrative stays the same, but we need to see the data within the narrative, the data within the narrative, but then we also attach it to the continuums. So in direct service or program support, we need to see the quantifiable numbers. In capacity building and systems change, we need to see where you are along the continuum of building these changes within your organization or the field if it's systems, and ultimately what that will enable you to do quantifiably. So you can see in this grantee capacity, we're increasing revenue and we hope to benefit 2,000 community members by building a capacity. For the systems, you can see it's going to take us a little bit of time, 2027, but ultimately 35,000 community members will benefit if we effectively build whatever the reform is that we're trying to do. Before I open it up for questions, I want to go through some more critical information, but I'm going to pause just for a second, because I know that was a lot of information, and just remind you that we're not trying to change your programs. We're trying to look at the achievement of the work that you're doing. So that who, what, how, and when. There are other areas that are critical to attach to that who, what, how, and when. And the first and foremost one is thinking about your organization as a whole and your past achievement. We all know that past achievement is a good indicator of future success, but what also is more important is the times when you didn't maybe succeed as well as you want, or the challenges that you face and how you manage through them. Because learnings are sometimes more important than results, because that's how we change, how we grow, how we deepen impact. So you can see here, we look at what has been achieved, the challenges you face, and what you've learned. Specifically also making sure that you're involving that voice of the community, because we are trying to change and improve the community, the Pottstown community. I mentioned earlier that we talk a little bit about demographics. The first place we want to think about demographics and equity is within your own organization. What is your organization doing about equity and to grow it and to support it? So tell us, kind of what steps you've taken, and tell us how the progress that you've made in the past year. The demographics for the population that will benefit are a little bit more quantifiable. So you can see we're going to ask for the zip codes, which I think the foundation's always done, but now we're starting to think also about the demographics of those that will benefit from your project or work, or even those that you're directly serving if it's programmatic. So tell us how many, the percentage by marginalized populations, and demographics such as ethnic background, gender makeup, and age range. So again, I don't think that's unusual, but we want to make sure that you know that those all should also be seen through your narrative of the who, what, when, because we are focused a lot on equitable access through each of our programs. The next thing that we want to make sure is the foundation wants to make sure that you have the resources you need to move forward. So they've developed some tools to support you. The first one is a results workbook. Again, each of these tools will be emailed to you. I believe they'll be on the website as well, but this will step you through how to think creating that concise statement. And you can see right there, it has the who, what, how, the who, what, when, statement to get us to a result statement, and it steps you through each one of them. We also will give you a tool book or a work plan to create that the critical steps and milestones, the key elements and deliverables to take you through the if then when concept. So if we do this element, this is the progress point or achievement we'll have, and we'll get to it by this time. So a way to start thinking about it, a tool to help you. The final thing that I think you've all started to hear about is some one-on-one technical assistance, as we'll call it. What that looks like is direct one-on-one calls with me to go through your application to make it tighter before the foundation sees it. We'll ask you to provide some initial information, start the application, email me the draft. But at a minimum, I need to see these critical elements, tell me about the project title, what your term is, give me that brief summary of the project, but then get through some of the details. What are the elements, what you're looking to achieve, the project work plan, and how that ties into the indicators. You're not going to get it, 100% right. No, it's not a test of any sort, but it's a way that I can understand the program so we can get it as tight as possible. The foundation has 25 slots to do that. I will say that the move ahead emails to where we got invited to come have already generated, and I think 6 of the spots have started to be taken. So I'd encourage you, if it's something you want, to make sure that you get you sign up through the Calendly link. And again, we'll spend time together, the day before you'll send me the information, we'll spend some time together, and then I'll give you direct written feedback about how to make it tighter prior to submission to the foundation. Now I'm going to turn it over to Jill, who is the new grants manager that we're so excited to have here to talk about some of the timeline and next steps before we open it up for Q&A.
Thanks, Michelle. There we go. Appreciate it. Good morning, everyone. Here we're taking a look at the timeline for the rest of this spring grant cycle we're currently in. As you know, we are out of the LOI phase and applications are now open in the portal. We're here on step 5, joining us today for our information session. And as Michelle mentioned, those one-on-one technical assistance meetings start next week on the 14th. They'll run through the 30th. The link to sign up for that would have been in your move ahead notification, but we'll also be sending that information again in a follow-up email. So if you missed it the first time around, you will be receiving the information within a couple of days here. April 1st, that is when applications are due, and they will close in the portal. You will be receiving the final decision that last week of May, week of May 31st. And then should you be approved for a grant, following that 12-month cycle, you'll have an interim report due January 15th of next year, and then final report due July 15th of next year.
Thanks, Jill. We're going to open it up for Q&A. I'm going to pop back on just so that if you want to, we can have a chat. Remembering, as I said earlier, we will, all the slide deck will be sent to you. This is being recorded, as John said. The link to sign up for TA will be available. You should have it already. If not, we'll resend it. But we wanted to save enough time here to let you guys ask questions. You can pop into the chat. You can pop into the Q&A. We're monitoring both, but we want to make sure that you have your questions answered so that you can achieve success. So everyone's quiet so far. I'm hoping that, you can see your who, what, how, and when, but let me know if there's questions. Thank you, Heather. Hopefully you got some information to help you in this.
Do feel free to use the raise hand feature, everybody. If you have any comments at all, any questions, we'd love to hear your voice too.
Yeah, and I'll just put a reminder as well, jump in on if you want that technical assistance, jump in sooner rather than later and book a time because they're getting booked up. Okay. Looks like everyone is saying thanks. No questions though. Come on, we're not that clear.
John, I think you're muted, but I think you were trying to say something.
I see a hand raised.
Thank you, Jill. Yes, I was just, Jeannie, I see you've got your hand raised, so yeah, we'd love to hear from you. Go ahead. It looks like you might be muted, Jeannie. Oh, okay. So yeah, I guess I'll close us out then. So thanks again for joining us, everyone. I think we're going to have a follow-up email, so be on the lookout for that from Jill. Who said I have a recording of this session, copy of the slide deck, the copy of those tools, and all that's located on the results framework section of our website as well. So do visit that, and we'll share out the link again. So again, thank you for joining, and take care, and thank you for all you do for the community. Appreciate it.